Ladies and gentlemen, thank you for standing by, and welcome to the Health for a Change Data webinar. During the presentation, all participants will be in a listen-only mode. Should you wish to ask a question during the presentation, please use the chat feature located in the lower left-hand corner of your screen. If you need to reach an operator at any time, please press *0. As a reminder, this conference is being recorded Wednesday, September 28, 2016. I would now like to turn the conference over to Rachelle Seger. Please go ahead.
Good afternoon. Thank you everyone for joining us today. This is Rachelle Seger. I work here at the Foundation for a Healthy Kentucky. I'm the Community Health Research Officer here, and I'm honored to be working on the Foundation's data initiatives. So as you can see, the title of our presentation today is Kentucky Health, Making Data Count. We have a great lineup of speakers today. I'm glad you're joining us. This webinar is part of the Foundation's Health for a Change training series. The Foundation offers this training series free. We have webinars, in-person workshops. They're really designed to support the efforts that all of you are doing across Kentucky in community health coalitions or at health departments, local health agencies, or at advocacy groups, really to further and improve the health of all Kentuckians. So I'd like to take just a moment to remind all of us what we do here at the Foundation for a Healthy Kentucky. Our mission is to address the unmet health care needs of Kentuckians. That photo there on the screen is from an evaluation workshop we had. And as you can see, evaluation is always a great topic. Full house we had on that day. The Foundation does its work by making grants, by doing research, and conducting data programs just like this, with this mission to improve access to care for Kentuckians, to reduce health risks and disparities, and to promote health equity. Our Foundation's website, healthy-ky.org, you can find a lot more information about the Foundation, our data reports, and we'll also have an archive of all the trainings that we've hosted, so you can check out that at a later date. Finally, the final piece of my introduction, I'd like to remind you to save the date. We have 2 upcoming Health for a Change trainings. The first one will be October 25th. That'll be a webinar. That webinar will be conducted by Kentucky Public Health Leadership Institute, and they'll discuss the Board of Health Toolkit, designed for accreditation and quality improvement in Kentucky's boards of public health. The second one will be an in-person workshop not to be missed about fundraising and grant writing. That will be conducted by Dr. Bob Long. Maybe some of you on the call attended the last training he held for us, which was dynamic and very exciting, filled with lots of great information. Dr. Long is a visiting professor at Murray State University with a focus on nonprofit leadership studies. Save the date. We'll have those registrations open for you very soon, October 25th and November 2nd. So first on our call is Sarah Ehresman. Sarah is with the Kentucky State Data Center at U of L, and she's going to lead us through some data pieces where she's an expert. Sarah, welcome to the call.
Thank you so much, Rachelle. So as she just said, my name is Sarah Ehresman, and I'm the Research Coordinator at the Kentucky State Data Center housed at the University of Louisville. I wanted to start off by quickly giving you some background about our organization. So we're actually a partner of the U.S. Census Bureau. We're within their State Data Center program, which makes us Kentucky's official clearinghouse for census data. Our focus is on data promotion, education, dissemination, and research, in particular using census data. But I also want to mention that we have a data sharing agreement in place with the Kentucky Cabinet for Health and Family Services Office of Vital Statistics. So we have access to birth and death records in Kentucky. We submit this data to the Census Bureau, but we are also allowed to share it in aggregated form. So we partner with organizations to help provide this data online in a meaningful way. One of our primary partners in this regard is the Foundation for a Healthy Kentucky. So you can access data on health outcomes and maternal and child health for Kentucky on kentuckyhealthfacts.org based on birth and death records that we've processed. We also partner with the Kentucky Youth Advocates to put measures up on the Kids Count Data Center, which focuses on measures of child well-being. The small staff at the Kentucky State Data Center are data people, and we're also familiar with a lot of other federal data sources like the Centers for Disease Control and Prevention, the Bureau of Labor Statistics, and the Environmental Protection Agency. We do not conduct any surveys ourselves or have access to primary data sources. Rather, we know a lot about secondary data sources from national and some state agencies. I'm always happy to answer data requests and, to the best of my ability, try to get you data or put you in touch with another organization who can hopefully help. But today I'm going to go over data citations and then a discussion of data maps. So let's get started. Data citations are crucial because they ensure data can be discovered, reused, replicated for verification, credited for recognition, and tracked to measure usage and impact. Using data with a complete data citation means that you should be able to go back to the original source and recreate the statistic presented. So what is a complete data citation? Data citations should include the publishing agency. So an example of this would be the Centers for Disease Control and Prevention. This should be followed by the specific program within that agency that the data came from. For example, if you had a statistic based on the National Health Interview Survey, which is a program of the CDC, both should be listed in the citation and not just the CDC. You also need to include the time frame that the data is reflecting. We need to have a title or description of what the data shows. And it also needs to be clear who the data is reflecting. Is it the population of a certain age group, the population who are currently working full-time, or is it simply the total population? It needs to be very clear. Whenever possible, try to provide a URL to the data so that any interested party can easily find the same place you retrieve the data. Some data sources have an addition or version of the data which should also be included in the citation. An example of this are data from the Robert Wood Johnson Foundation's County Health Rankings. So the 2016 release included a measure of premature deaths based on data from 2011 through 2013. Both of these dates should be reflected in the citation so that you know the data itself reflects the 2011 through 2013 time period and that it was published in the 2016 release of the County Health Rankings data. You can also provide the date the data was accessed online in case there end up being later revisions to the data, so you know the exact time in which you accessed it previously. And then lastly, if any additional processing was performed on the data by an agency distinct from the original publication, whether that's you or a third party like us at the Kentucky State Data Center, you'll want to mention that as well. So here we have an example of a well-cited data table. We see the publishing agency followed by the specific program within that agency. So it's the U.S. Diabetes Surveillance System from the Centers for Disease Control and Prevention. We have the year listed here in the citation and also up here in the table. So in this case, the publication and the reference period are the same. We have the title of the statistic, which is the diagnosed diabetes prevalence, as well as the population it reflects, adults age 20 and older. And then down here we have the URL to access the same data. So if you were to pull a statistic from this table, you would know exactly where it came from and how to find the exact same number on the Internet. So suppose we want to know what was Kentucky's 2014 uninsured rate. Here we see three different rates presented for the uninsured in Kentucky from 2014, 6.7%, 8.5%, and 9.9%. And they are all sourced as the U.S. Census Bureau. So which one is correct? Well, we don't really know because there's not enough information in the citation to verify the data. Simply citing the U.S. Census Bureau is not a complete citation. So now I want to go over each one of these rates, give it a complete citation, and discuss the census program it is from so we can determine which figure best represents the uninsured rate for the state from 2014. So first, we have Kentucky's 2014 uninsured rate as 6.7%, with the complete citation as the U.S. Census Bureau's Current Population Survey Annual Social and Economic Supplement published in 2015 with a link provided. And sure enough, going to that link will allow you to create this table where you see health insurance coverage in 2014 for Kentucky, uninsured, percent as 6.7. But you might also notice down here in the small print Inferences should be made with extreme caution when the cell sizes are small. So this is a warning that the sample size of this survey might be subject to a lot of uncertainty. And in fact, the current population survey annual social and economic supplement has a relatively small sample size, and the Census Bureau does not recommend using it as a source for state-level estimates of the uninsured because of the uncertainty associated with the small sample size. This program is an appropriate source for national-level estimates of the uninsured, but not for the states. I'd also like to point out that different surveys ask questions in different ways. The phrasing of the question related to health insurance coverage on the current population survey is such that it only counts a person as uninsured if he or she did not have insurance for the entire calendar year. So it is more likely to be a smaller number because if a person had insurance at any time during 2014, he or she would be counted as having insurance. The phrasing of the question on different surveys can impact the measure that you see. So we've ruled out the 6.7% figure as an appropriate statistic because of the small sample size of the current population survey's annual social and economic supplement. So now we have Kentucky's 2014 uninsured rate presented as 8.5%, with the complete citation as the U.S. Census Bureau's 2014 American Community Survey one-year estimates, with a link provided that will take you to this table showing Kentucky's percent uninsured as 8.5%. The American Community Survey has a larger sample size than the current population survey, and it is the Census Bureau's preferred source for state-level estimates of the uninsured. This is the most appropriate census data source for our particular research question. However, you should keep in mind that the sample size of the one-year estimates from the American Community Survey is still too small for most county-level estimates. So if you needed to do a comparison of the state to individual counties, this could be a problem. Also important to note is that the American Community Survey is an ongoing survey, collecting responses from households throughout the calendar year. This survey counts a person as uninsured if he or she does not have insurance at the time they are filling out their survey. So if you responded to the survey in January of 2014 and did not have insurance at that time, you would be counted as uninsured, even if you happen to gain insurance coverage sometime later in 2014. Lastly, we have Kentucky's 2014 uninsured rate as 9.9%, with the complete citation as the U.S. Census Bureau's small area health insurance estimate from 2014, along with a link where you can view the data. And sure enough, for 2014 in Kentucky, the uninsured percent is 9.9. The Small Area Health Insurance Estimates Program only reflects the population under age 65, which needs to be clearly stated in the description of the uninsured statistic. Because the population over age 65 is most likely covered under Medicare, excluding this age group will cause the uninsured rate to increase. The Small Area Health Insurance Estimates Program is the best available census source for uninsured rates by county. However, the data release occurs later than other programs because it uses a combination of survey responses and mathematical models. The 2015 data is not scheduled for release until early next year, whereas the 2015 data from the American Community Survey was released earlier this month. Okay, so I just covered 3 different programs from the Census Bureau on health insurance coverage, but there are other sources out there, including places like the CDC, survey firms like Pew and Gallup, as well as independent researchers. A complete citation is absolutely crucial for verification and context of the data. We know that simply citing the U.S. Census Bureau does not provide enough information to determine whether the data is an appropriate statistic. All right, so now I'm going to switch gears and discuss data maps. Viewing data on a map is helpful for identifying spatial relationships. One of the earliest data maps used in the context of public health was John Snow's map of cholera cases, which made evident the relationship between the cholera outbreak and the contaminated water pump. Here is another example of a visually striking data map. Life expectancy at birth for males and females for Kentucky counties based on data from 2010 through 2014. Because both maps use the same classification system down here in the legend, you can see right off the bat that females have a longer life expectancy than males. You can also see that for both genders, the lowest life expectancies are in southeastern Kentucky, and the highest life expectancies are in the north central Kentucky. And you didn't even have to look at a single number. Although data maps are very helpful in identifying spatial relationships, you also have to be careful because, like other displays of information, they can be misleading and require a critical eye when interpreting. When I was in graduate school, I was assigned to read this book, How to Lie with Maps, to understand some of the ways information can become distorted when placed on a map. So I want to now discuss some of the things that you as a map reader should be looking out for when interpreting data maps. So here we have a map of drug arrests in 2014 for Kentucky counties. It's a clean map with an appropriate data source. Looks pretty good, right? Well, one thing you should always be on the lookout for when viewing data on a map is if the map is presenting totals of some measure, or if the map has accounted for the total population within each area, or some other useful measure like maybe geographic area. This map is showing the total number of drug arrests in each county, which means we're most likely just looking at a map of total population. Because in general, more people in a place will lead to a greater number of occurrences in that place simply because more people tend to do more things. So here we have the same data, drug arrests in 2014 by county, but this time it is presented as a rate per 100,000 population. By accounting for the underlying total population within each county, you can see the spatial distribution is very different from what we saw on the previous map. So another thing to be aware of when viewing maps is that the person who creates the data map gets to choose how many and where to cut off these data groupings that are presented in the legend. So these two maps actually show the same data set, the teen birth rate by county over the 2010 to 2014 time period, but the way the maps look and where your eyes are drawn to are pretty different. And this is due solely to making these 5 categories down here in the legend of different ranges. So this should reinforce the idea that several elements of subjectivity are present in map making, and the map creator does have the ability to change the way the maps look and what you as the reader take away from it without actually compromising the underlying data. Lastly, I wanted to give you an example of a map that I think is not a great visual representation. Here we see the 5 healthiest and 5 least healthiest counties in each state based on the county health rankings data. Your eyes are really drawn to the dark areas in the west and in the northeast, but this is largely due to the fact that the counties in these regions are simply larger than counties elsewhere. But your first impression might be, wow, the west and the northeast are really unhealthy. This is also due to the fact that even though we are supposed to be looking state by state, the map is shown as the continental U.S. As researchers, we know that the least healthiest counties in the United States are in the South, but that is not the takeaway from this visual. So whenever you're looking at a map, it's important to think about what the author might be wanting you to take away from it versus what the underlying data actually says. And with that, I've concluded my sections on data citations and data maps. My contact information is provided here. Please feel free to contact me with any questions. And now I'll turn the presentation over to Joe Benitez from the University of Louisville School of Public Health.
Hello everyone, and just want to say thank you again to Sarah for such a great presentation on looking at maps, utilizing maps, and kind of getting into what to actually take away from maps and how to think about how to validly criticize what you're actually looking at. So my presentation is a follow-up on that and kind of looking at it in a different way. So a lot of what we see and where we draw our information from is visual. So while extending into data visualization as well as how to critique visual data. I also want to give you an introduction on finding data sources as well. So not just how to look at data, but also where you can actually get data so you can do your own analyses and where you can actually get viable sources that you would see as potentially credible. All right. So data can come from any number of sources, and let's say we're looking at, if we want to look at national data, or if we want to look at state-based data, or even some other types of data that we can get from places. So depending on what our questions are or what we want to know, that would depend on what type of data we want to use, as well as where we might actually get our data sources from. So places you can actually get data from, these can be national places, particular places from the federal government, state-based resources, and then there's some university-based resources as well that I think are worth paying attention to. Okay, so some major national data sources that I would say are worthwhile, particularly in some of the work that I do. So there's the Centers for Disease Control and Prevention, which houses the Behavioral Risk Factor Survey, which I'm presuming that a lot of you are fairly familiar with. There's also the NHANES, which is the National Health and Nutrition Examination Survey, as well as the National Health Interview Survey. So these are some fairly broad-based, health-based surveys that the CDC collects on an annual basis. And then to kind of echo on what Sarah was mentioning earlier, there's some data sources at the Census Bureau. So for example, there's the American Community Survey, the Current Population Health Survey, and as she mentioned, there's the Small Health Insurance Estimates, which tend to be county-based. In addition to that, if you want to complement some county-based estimates with of health as well as health insurance coverage, you can also use the Small Area Income and Poverty Estimates, which are county-based estimates on percent poverty that the Census Bureau releases on an annual basis. Additionally, there's the Health Resources and Services Administration, which is another federal agency that houses the Area Health Resources File, which is it's a large data repository which houses, I think it's up to about 8,000 variables now that you can access at the county level. There's also, particularly if you're interested in what types of resources your county might be utilizing, or if you're interested in gaining more resources for your county or considering that your county might be underserved, there's also health professional shortage area designations as well as medically underserved population area and population designations as well. And what this means is that with these designations, they're eligible for certain resources that will be sponsored by the federal government, particularly through HRSA. Okay, so some more Kentucky-specific data sources. So there's several resources that are housed at the Kentucky Cabinet for Health and Family Services. And in particular, another data source I use is the Kentucky-specific Behavioral Risk Factor Survey, which has some slight tweaks that make it a little bit different from the National Behavioral Risk Factor Survey, and particularly as it pertains to Kentucky, I find it to be a valuable resource. To give a compliment to Sarah as well, I cannot stress enough the helpfulness and the value of the Kentucky State Health Center folks. Very bright people, as well as extremely helpful, and they provide a lot of great services for people that have data requests as well as any general questions about data as well. There's also the Center for Poverty Research at the University of Kentucky. So particularly there's a group of Kentucky researchers that study poverty, and in this they have a lot more detailed measures about poverty, not only for Kentucky but for counties in the rest of the United States as well. And in addition to, I would also like to give a shout out to our host and another data source, which is the Kentucky Health Issues Poll, which is supported by the Foundation for a Healthy Kentucky, and it provides a snapshot on a lot of views pertaining to Kentucky about healthcare and health policy issues, as well as public health concerns as well. Okay, so some resources that are located at other universities. While I mentioned some that were at universities, here's some additional sources that some of you may or may not be familiar with, as well as some that are at some non-governmental organizations. So the Inter-University Consortium for Political and Social Research at the University of Michigan, it's a large data archive of probably 250,000 files of research data, but it provides access to a lot of downloadable files that can be used for research or for use for analysis, and particularly that varies based on the types of questions that you might want to answer. The county health rankings, which were mentioned before, it's a collaboration between the Robert Johnson Foundation and the University of Wisconsin, and if you're interested, I provided access to the link so you can go to the rankings for Kentucky. And then there's America's Health Rankings, which provide a ranking of the states based on their health status using a number of indicators that the research team uses. Okay. So now in thinking about how to look at data visually, as well as how you would garner the value of something, of some visual representations of data. Okay, so most visual representations of data, they would usually be graphics, charts, tables, which we use to summarize the data, and we often want these visual representations to tell a story or give the punchline of research, but also what we want to communicate to policymakers or people who act as decision makers. But one thing to always be worried about is some can actually be misleading or even inaccurate, and some of this can be intentional, but some of it is frequently unintentional. But based on how data is presented, some of the wrong conclusions may be actually taken away from a particular graphic or visual representation. So some of the major, there's several others, but these are probably the main three that could potentially mislead readers or anyone that's looking at the particular graphic. So one is omitting data, particularly if your data is covering a particular time period and you only limit it to a certain window of time, that it may cause someone to be a little wary of what's actually going on. As Sarah mentioned before, improper labeling. Improper labeling of data, so it's always thinking about the citations of the data, where the data is actually coming from, and as well as what years it might actually be covering. Some others, these are a little bit more, might require a little more skill in actually noticing for. So particularly looking at if the graph is actually the right size. So if it's too big or too small, if it skips numbers, then this other one is a particularly large issue, is not starting at the baseline value or say 0 if you're trying to compare trends across time. So for example, so this is a pie graph, and I just pulled a few places on kind of what examples are some tidbits that you might actually want to look for on, judging quality of graphs. So what might you say is wrong with this pie chart? So at first glance, it seems viable, but then you kind of look into the numbers and see, okay, something doesn't quite add up. So this is a pie chart, describing years of experience required by employers. And you would expect that there's going to be some employers that are more leaning toward entry level, some that might be wanting a little bit more senior people with 3 to 5 and even possibly 6 to 7 years of experience. But something that we noticed, so a pie chart should always come sum to 100%, but as we can see, so we take 41%, 31%, and 50%. So this is a real graphic, by the way. But we see that it comes to 122%. So this is actually something that we do actually encounter. While this is something that I was able to pull from the web, there's other real examples that you might see, particularly if you watch TV or read newspapers, that you might see this type of example. So the main drawaway is that 122 is not equal to 100, which is exactly what a pie chart should equal under every circumstance. So let's go to another example. So not a pie chart, but something else that's different. So first glance, everything seems right. So what the article that cited that used this chart was trying to convey was that the value of going to college is actually not worth the cost of college. So to say your earnings from going to college are actually not worth it, to say that they're actually decreasing. But some of the things that we should notice, so these are average salaries, so your annual income as opposed to your yearly earnings. So the main thing is that, so this article is misrepresenting annual incomes as lifetime earnings. So if you kind of think about how much a college graduate is going to earn over the course of their lifetime, it's going to be much more than how much they earn in any single year post-graduating. Another point is it's only showing the earnings for college graduates and not showing the earnings for someone with only a high school diploma or, say, even less education. And we tend to know that people with more education tend to do better economically and financially than people with less education. So kind of when you're looking at visual graphs, you want to kind of study them and kind of get at the validity of what they're representing or the conclusions that they're trying to lead you to believe based on their graphic or someone else's interpretation of the graphic. So here's another one. So what might you think is wrong with this graphic? And these are just some numbers, just from a certain range, and you can pretty much say, you might say that these are different earnings over time, or these could be just different earnings between groups, but you would think that the difference in earnings between A and E is incredibly large just because of the way they scaled this graph or what they chose to use as a starting point. So notice on the y-axis of the graph that they actually start off at 9,100 as opposed to starting at 0, which is standard practice and what you should do when you're developing a graph such as this. Because what it does, it actually it would standardize what you're looking at. So now we take a look at this second graphic. So one thing that you might say, okay, so now they look fairly flat. But we should know that these are actually representing the same exact data. But you see in B that, which is a correct representation of the data, but now the differences don't look as large at all compared to when you look at A. So this is one example that I pull from, but you will see differences like this all the time in a lot of places when you look in different sources of media. So some of the major points that many practitioners would say are useful in developing visual aids is the design of the graphics should be appropriate given the data that they represent. The next point is that complexity is not something that necessarily makes a graph any better, and in the sense, less is more is definitely a true statement in how you present graphic information. So you shouldn't use a graph that's meant to overstate the complexity of the data, or the analysis that was used, or even the major results. So they should be able to also stand independently on their own without much additional text. These are some of the things that are common in what you may call, quote unquote, more useful or more informative graphs. So what actually makes a good graphic? So something that is fairly straightforward, it's simple, easy to understand, it conveys the message well, and provides a good and accurate representation of the data. So on the other side, some characteristics of quote-unquote bad graphs, graphs that are intentionally misleading, or they are overly complex, or they do things that might distort the data. So some of the ways that you can actually distort data, so particularly in graphs, you're adding unnecessary decorations. You're adding three-dimensional effects. So the human eye is normally good at assessing two-dimensional relationships and two-dimensional representations, but adding the third dimension, it adds a little bit of complexity that can actually take away from the information that you're supposed to be gaining from the graphic. So anytime that you see a graph with 3D effects or even too much color, too much text, these are things that start taking away from the information that you're supposed to be gaining from the graph. As I mentioned before in the previous example, the most recent example, any truncation or improper scaling of the data, such as selecting that you want to start off at a much higher point than 0, it can also distort the information. And the last point is emphasis, so such as drawing attention to a particular point in the graphic, such as italicizing or adding bold or shadow. So these are things that you shouldn't necessarily do when you're producing graphs. Can't stress this enough, graphs should be fairly simple and avoid complexity. The most straightforward and simple graphs and tables, they tend to be the most informative and useful for a variety of people. You should also avoid anything that would distort the data, and you should also be wary of graphics that do distort or do anything that would misrepresent the data. So some of the examples that I drew from are from this book by Edward Tufte, who's he's a major researcher in this area, and if you're interested, here's the link to the book, and if you or your group is interested in investing in this as I'm not getting any sort of reimbursement from this, but I think it is a useful text to read, so you may be able to find it in a library or any other type of place that I think is a useful source for tips on how to present data as well. So my contact information is provided on this screen, and please feel free to email me if you have any follow-up questions as well. So, thank you so much for allowing me to present some information to you, and I hope you enjoyed it.
Great, thanks, Joe. This is Rachelle. I'm back again from the Foundation for Healthy Kentucky. Joe, in describing Tufte's book, also reminds us that this webinar is hosted and funded by the Foundation for Healthy Kentucky. So our other speakers on the line today were not remunerated for their participation. I'm going to take a little different angle in my last few minutes here on the call with you, and we will have some time for questions and answers. So please do chat in your questions via your chat box there on your platform. I want to remind all the participants that the presentations, our presenter slide decks will be available, and we have one additional thing I'll get to at the end of the presentation today. What I wanted to focus on was a slightly different angle on research and data and some questions that the American Association for Public Opinion Research has put up. That website citation is there on the bottom when writing or thinking about polls. So I wanted to focus on these first 3 questions that they ask, and think about that in terms of what we're doing here today, maybe thinking about viewing different data sources and how that might impact the way the data is presented. So we might see some nice data visualization that looks really convincing if we read it somewhere in a published report or in the media somewhere. But again, I want to remind us that we should be asking these types of questions when we're looking at reports or data. So who funded the poll? How was the poll conducted? What questions were asked? So first off, who funded the poll? thank you for Joe and Sarah for mentioning the Foundation for a Healthy Kentucky's Kentucky Health Issue Poll, but that poll is funded by the two organizations you see here on the right. The Foundation for a Healthy Kentucky partners with Interact for Health, a foundation based out of Cincinnati that also serves northern Kentucky. So we're partners on that Kentucky Health Issues poll. We both fund it jointly and we both plan it jointly. So that's important when the Kentucky Health Issues poll is out in the public, that I let people know that it's jointly funded by those two organizations. Sarah talked a great deal about the U.S. Census Bureau funding the surveys on a lot of different topics. So that's obviously federally funded surveys, a lot of those surveys we have. And the third example I wanted to give you was the sugar study. I don't know if anyone on the call saw this one, but it caught my attention because I'm always thinking of this question when I look at research and who funded the poll. So maybe you saw the article. It was in the September issue of Journal of American Medical Association, Internal Medicine. The title was Sugar Industry and Coronary Heart Disease Research. Gets better. A historical analysis of internal industry documents. So essentially, this researchers at the University of San Francisco looked at all of the documents that were in the basement of Harvard, and they found that some of the researchers who were doing published research on coronary heart disease were funded by the Sugar Research Foundation. Okay, why is that important? So it looks like when we look at this research that not only was the Sugar Research Foundation funding the research, but that funding status was not disclosed. They also, if I understand the article correctly, had some review oversight over the research before it was funded. This is one recent example I just wanted to bring up to you so that we're conscious that when we're looking at polls, we're looking at research, kind of think about who funded it is a nice starting point to establishing what we know about the survey. Next up, it's always nice to think about how was a poll conducted. So was a poll a face-to-face survey of people on the street? Was it a telephone survey where people were calling adults in their houses on their cell phones or their landlines? This is the method that we use for the Kentucky Health Issues poll. Was it a web survey? Did people answer it in their homes on their laptop computers? Or was it a convenience survey where people who were maybe buying a product were asked to fill out a survey when they purchased this, or maybe filled out a survey when they downloaded the app onto their mobile phone? So again, thinking about how was the survey poll conducted is a nice piece to think about when we look at poll results. As Sarah mentioned in talking about the Census Bureau data, it depends on who was included in that survey. Maybe it was only adults. Maybe the survey asked questions of all of the household members. So those are important things to think about when we're reviewing research and polling results. Next up here I have a graph from the Kentucky Health Issues poll. So as Sarah and Joe were going through their discussions this afternoon, I was kind of checking off the marks whether or not I had these included in our graph here. So you can see that access does start at 0. We included as a title the full question wording. You can see also in the parentheses that it says percentages do not add up to 100% because the response rate don't know is not included on this graph. So this is a question we asked Kentucky adults on the Kentucky Health Issues poll about whether or not they favored or opposed a Kentucky state law that would prohibit smoking in most public places. Here's the web link where you can find the full report on that. So again, when we're looking at poll results and we're thinking about maybe just a visualization or a pie graph that are presented, we would want to know what was the exact question that was asked on the survey. Here's a great example that I found when I was at my dentist. So questions on risk factors. All of us have filled out health information sheets at our doctor's office, or maybe we're on the other side of things where we're planning that health information worksheet for a medical provider or some sort of medical system. So we want to be cognizant of how those questions are asked. So in my dental office, I got this patient medical history form, and I was going through it, filling out my responses, and I noted this question. You see here the responses are yes or no, and then you see that question I've circled. The question asks, do you use alcohol, cocaine, or other drugs? yes or no. Now obviously this is a very important risk factor for any medical provider for assessing whether or not this patient would be at risk for, say, gum disease or other health problems. So it's an important question. But do they really get the answers that they need by asking this type of question? My answer to you would be no. I kind of got a chuckle out of this question. Alcohol, cocaine, and other drugs, lumping it together in one category is not very useful data when they get back to the office or reviewing records later. So that's a problematic question. One of my favorite examples. The third example under this, looking at the question, Pew Research Center does some excellent research, and what they did in 2003 was compare two different types of question wording, and they asked this question. On one survey, they asked on the topic about whether or not they would favor or oppose military action in Iraq to end Saddam Hussein's rule. Okay, what does that have to do with Kentucky health data? Well, here's the other part of the question, the other question that they asked of their survey participants. They asked, would you favor or oppose taking military action in Iraq to end Saddam Hussein's rule? Again, those two questions sound the same so far. The question goes on, even if it meant that U.S. forces might suffer thousands of casualties. Again, they saw when they included the idea of casualties in their question, response rates were dramatically different. In the first question, 68% of people said they favored military action. In the second question, where casualties were included in the question wording, only 43% said they favored military action. Question wording, as we all know, is extremely important in planning, designing surveys. So to Joe's and Sarah's presentations this afternoon, if we see a visualization, we can look at the data and think about what it might mean or what the report says that's around that data visualization, but we really need to dig a little deeper and find where that information is. What I love is when the citation, the survey is easily available for us as researchers so that we can find that original report, or we can find the data citation, or maybe we can even find the exact question wording. Here's some examples of data citations that are reports, first from CDC, second at the Foundation for a Healthy Kentucky's website, kentuckyhealthfacts.org, and finally from the Kentucky Behavioral Risk Factor Surveillance Survey. These three examples are all provided right there in the reports so that we as data users can grab the citation, put it in where we need it, and we know where the data citation came from. I don't know if you all have ever written a grant or heard a data reported somewhere and you cannot find the citation. Maybe you even wrote the grant needs assessment. It's great, you're trying to update it for your next grant application, but you just didn't cite it anywhere. It's extremely frustrating. So I think as data users, as producers of reports, it's all something that we can remember. If we cite the data, it's going to make it a lot easier for us in the long run. All right, next up. Resources in big, bold letters. So what the speakers have done, Sarah, Joe, and I, have put together some of our favorite data visualization websites, our favorite website resources, and we're packaging that together in a PDF. So all of you will receive that. What it is a starting point, some of our favorite sites that we want to share with you. One of those has two pieces from the Kentucky Department of Public Health. Thank you, Sarah Robeson, who I think is on the line with us here today. So one piece of that is going to be the Data Resource Guide. That is a great resource guide that they've put together that shows a lot of different resources for Kentucky health data. The second piece, also put together by Sarah Robeson's shop at the Kentucky Department of Public Health, is a county-level data sheet. So again, frequently we're looking for county-level data, and that has been put together by Sarah Robeson. So those are two pieces that will be included in this resource PDF. Also sites that will guide us through building our own data visualizations. Again, a lot of additional reading if anyone's interested in digging deeper about how to present data accurately, what are some things we can look for as data users. So you'll receive that later today. We'll have that posted. So we have a few chat questions. Let's The first one. Oh, this is a good one. And I'll take this, Sarah and Joe. Our committee is looking for all of the available health data resources for our area. Where should we start? Well, we'll have this resource guide available for people, so that'll be a great starting place. This is always a hard part when we're looking to study a topic or looking to figure out where to make health improvements in our community. We have this feeling that we just want to find all the data sources. And I would suggest you check in with some of the other data people, check in with Sarah Robeson's document to see what available data is there, and then get started. There's no time like the present to start our projects and to get moving in community change. So that would be my recommendation to that question. Let's see, Sarah, I have a question for you. Does the Census Bureau collect other health data?
So the short answer is no. There are several programs that look at health insurance coverage, which I went over the 3 major ones from the Census Bureau. And the only other topic that I might call a health topic would be disability status, which is available from the American Community Survey. The big thing that I think the Census Bureau provides for health researchers is going to be more context, so more about the social determinants of health. So there's going to be a lot of information on income and poverty, housing, information on housing units like their age, and so other information, educational attainment that can contribute to health outcomes but are not directly what I would call health data.
Great. Sarah, don't go anywhere. I have one more question for you. Let's see. Is it possible to make a map of the uninsured without using GIS?
Yes, it is. So actually the Small Area Health Insurance Estimates Program, which I talked about, and there's a link provided in the resource guide, actually has an interactive map as part of its visualization tool. And so you can go on there and play around with that tool specifically for that program. And so that's going to be all county level estimates of the uninsured. And then American Fact Finder, which is the Census Bureau's main sort of website for looking at their data products, also has a mapping feature. You can't get very specific into how much control you have over the map. It does sort of auto-generate how the map will look. But it is a starting point, if you just want to kind of get a visualization of uninsured rates for all the states, you can go into American Fact Finder and make a map that way. And then if anyone wants to do that, I'd be happy to help walk them through that.
Great. We have another question. It looks like it'll be our last question. And so Sarah and Joe, if you want to chime in and give a brief answer. This is a great question. I hear it frequently. What is the best resource for current information? Do you find that most resources are very dated? This is a great question, and I get it frequently. And what in terms of looking at who's doing the polling, you also want to look at the time period of when the people were polled or when the data was collected. But with respect to a lot of different things, sometimes data and opinion doesn't change as quickly as possible. So maybe the data resource that came out in 2014 is the most current available. So that will be what we should use for making our decision making. Sarah or Joe, do you want to chime in on this question about current data?
Sure, and I can chime in. So particularly for like a lot of resources when they're a lot of data sets when they're conducted statewide or even nationwide, they tend to be very resource intensive. So they tend to be expensive in order to collect such valuable information. So particularly for the Behavioral Risk Factor Survey. So the most recently available data is the 2015 wave of the survey, and it was released just last month. This time a month ago, it was released. So that would be the most recent version of the Behavioral Risk Factor Survey. So the 2016 wave is actually still being conducted, and as far as I know, the CDC doesn't actually release any interim version, so like a midway 2016 version. So they prefer to release the complete versions of data once they've been cleaned and verified and checked for errors and mistakes, and so that they have the code books and any other types of resources, so when they are available to the public, they're as helpful and as useful as possible.
I would echo that. The Census Bureau's American Community Survey is the largest survey put out by the Census Bureau, and the 2015 one-year estimates were just released earlier this month. And so I think that's actually a really impressive sort of turnaround to have the data out 9 months after its last survey went out, because they're still surveying through the end of December in 2015. So I think currency is a problem sometimes, but it's getting a lot better. A lot of times another way it's addressed is to aggregate several years of data. The Census Bureau does this in their 5-year estimates, and so that's when we run into a little bit of a problem in terms of currency. However, it's a trade-off between that and having a more accurate number because our sample size is larger if we aggregate the data over a longer time period.
Thanks, Sarah. And I wanted to share with everyone, here's my contact information. Like Sarah and Joe said, I'm happy to answer additional questions or follow-up questions. Here is the Foundation for a Healthy Kentucky's different websites you can check out. Our KentuckyHealthFacts.org is a great site. Also on there, there's a resource tab that has a lot of listed different Kentucky reports or different data sources there. So that's a great place to stop by on the resource tab. If you want your resource added, feel free to contact me. I'm happy to do that. And finally, thank you to Sarah and Joe for taking your time today to share your expertise with us. Participants, this afternoon you'll receive an email from us with a link to the event survey. Please take a moment, tell us what you thought, what you liked, what resonated with you, what you'd like additional information on, and we welcome your suggestions for future trainings like this. And finally, participants, thank you for being with us today. We've had a great turnout, a lot of people interested in data. Let's continue this conversation so that we can have great, reliable data for Kentucky. Thank you for chatting in your questions. Have a great afternoon.